Hi, class. It's Dr. Lindner. Let's take a look at some of these accessory organs here that are important. So we have the liver here, the L for liver. We got the pancreas and green gallbladder. Okay. Now these are major organs, but they're considered accessory organs of digestion. They're not considered the main players, but they're accessory organs. So when there was fat in the stomach and it entered the duodenum, here's the epithelium. The pancreas can release these digestive enzymes like pancreatic protease and pancreatic carbohydrase and pancreatic lipase. Pancreas produces the majority of the digestive enzymes needed to break down the food in the small intestine. That's why the pancreas is exocrine and endocrine. It's an endocrine gland and an exocrine. Endocrine is insulin, right? It produces insulin for blood sugar, but the majority of the cells of the pancreas are acinar cells. And those acinar cells are exocrine in function. The pancreas also produces sodium bicarbonate. Sodium bicarbonate, in terms of pH, when you look at the pH scale of 0 to 14, 7 is neutral. Sodium bicarbonate is over here. It's a base. This side is an acid. Basics are alkalinic. This is acidic. So sodium bicarbonate is dumping an alkaline substance into the duodenum, and for good reason, because the stomach is here dumping acidic content. So when you got acidic content coming in, the pancreas produces an alkaline content to neutralize the pH so you don't get a duodenal ulcer. But if the pancreas isn't doing the job and you just have acids dumping in here, again, too much acid with not enough bicarbonate, you get an ulcer. Now here's the gallbladder. The gallbladder is going to push when CCK, remember cholecystokinin, goes up to the gallbladder stores bile and toxins, cholesterol and phospholipids and water. It's going to contract, it's going to push it through this ductwork and come right out into the duodenum. If you have a gallstone here and you eat a fatty meal, oh boy, person's going to get nauseous, cramp, throw up. They're going to get pain between the right scapula, and that's usually a good indication of a gallstone. But typically, they just remove this. They remove the gallbladder. But functionally speaking, if you're born with the body part, you want to try and keep it your entire life, right? Let's look at the gut and let's try and heal up the duodenum, figure out what are the irritants going in that could be damaging this lining. There's a reason that you've got stones that are forming in here. There's stagnation, lack of movement. Okay, so remember the liver makes the bile, it produces it, but it stores it in the gallbladder. Cholecystokinin makes the gallbladder contract, pushes out the bile, pushes out the toxins, pushes out water, pushes out cholesterol, and now you have all that stuff in the intestines. Anything that's in here can get reabsorbed into circulation, but if you consume fiber, you can flush out the toxins and cholesterol. How cool is that? Causes of duodenal ulcers. Well, look, nice, good to repeat what we just said. The pancreas secretes sodium bicarbonate into the small intestine. The sodium bicarbonate from the pancreas and the bile from the gallbladder, they both help to neutralize the stomach acid and to prevent a duodenal ulcer. If you've got too much stomach hyperacidity and you don't have enough alkaline stuff to neutralize the acids, that's when you're going to get the duodenal ulcer. Okay. Some of the symptoms: pain in the abdominal region as well as the back. We're always going to see that, stomach pain and back pain. But this one's going to give you pain that may be experienced after eating. Remember, stomach ulcers had pain before eating. Duodenal ulcers typically give the person pain after eating. And the therapy is the same as it was for gastric and peptic ulcers. Now, when you look at Crohn's, which is also known as regional enteritis, a lot of people think Crohn's is spelled like this, but it's not. Make sure you get the spelling there right. So Crohn's is an autoimmune condition. It's an idiopathic inflammatory disorder that can affect the large and small intestine. They say it's a combination of genetic factors and immune factors. And 10 to 20% of all the people affected have some form of positive family history to it. Smoking is linked to it, dietary substances, and an unhealthy microbiome. Most people call the bacteria the microflora. We're not talking about flowers here. So it's the microbiome is the appropriate term for the bacteria in our intestines. So an unhealthy microbiome, and we remember that that is called dysbiosis. Now, Crohn's is also known as granulomatous colitis. Granulomas, look at that. Look at this is a nice smooth intestinal lining. Here's Crohn's. This is very inflamed, very hot, very red, very, very painful for people with Crohn's. So most of them will, I mean, this sometimes they'll have to have a few feet of their intestines removed if this happens, if they can't get it under control. Although it can affect any part of the GI tract, the ileocecal region is the most common, and that's right here, the ileocecal. And remember, that's where B12, that's where B12 is absorbed at the ileocecal region. Here's the ileum. Here's the cecum. It means blind pouch. Right here is the appendix. And then you start moving up to the ascending colon. So individuals suffering from Crohn's disease may show no other symptom other than irritable bowel, diarrhea, constipation, diarrhea, constipation. There's weight loss that could be linked with it, malabsorption of nutrients, especially B12, B9, and vitamin D. And they get severe abdominal pain. And the therapy for it is typically immunosuppressants. They give them immunomodulatory agents. Diet is very helpful, avoiding fried foods, high sugary foods, lots of flour, gluten could be damaging to it, and in many cases, surgery where they remove the granulomatous portion. Okay, when we come back, I'll just introduce the large intestine.